Hey, future Senior 202 Masterminds. It's time for another deep dive.
And you know what that means? More CNS meds.
That's right. We're going to unpack everything you need to know.
To rock that exam.
So get ready
For a deep dive into the fascinating world
of CNS medications.
Now, you're already familiar with the basics, but
What?
did you know that the dosage of a CNS depressant, it can totally change its effects?
Okay, that's pretty interesting. Like alcohol.
Precisely.
You have a little bit and you feel relaxed and more social,
Right.
but then you have a little too much
Uh-huh.
and suddenly you can't even walk straight.
Exactly. And that's why understanding the fine line between therapeutic effects and dangerous consequences is so crucial, especially for nurses.
Which is where tolerance and dependence come into play.
Exactly. It's like a seesaw. The more your body gets used to a CNS depressant, the more it needs.
To get that same effect.
Right. And that's where the risk of addiction and overdose really starts to climb.
Which is why close monitoring and patient education is vital.
Absolutely. Now, speaking of the brain, let's talk about sleep. You've probably heard about those different sleep stages, REM and NREM.
Yeah.
But here's something that might surprise you. Disruptions in REM sleep, that's the dream stage, can lead to memory problems and mood swings.
Wait, really? So even if I'm getting enough sleep, if my REM sleep is messed up, I could still have all these problems.
That's a classic sign of REM deprivation. And it's not just a minor inconvenience. Chronic sleep deprivation is a serious issue. It's linked to a weakened immune system,
Really?
an increased risk of heart disease, and even problems with cognitive function.
Wow, so we need to prioritize sleep. Now, I know we have a lot of medications designed to help people sleep.
Uh-huh.
What's the difference between sedatives and hypnotics?
Think of it this way. Sedatives are like taking the edge off.
Okay.
They calm you down and ease anxiety. Hypnotics, on the other hand, they induce sleep, help you fall asleep and stay asleep.
So sedatives are like a dimmer switch.
Yes.
And hypnotics are like an on-off switch.
That's a great analogy. And here's where it gets interesting. That line between a sedative and a hypnotic can actually get blurry. It often comes down to the dosage.
So a lower dose might have sedative effects,
Yes.
but a higher dose of that same drug could act as a hypnotic.
Precisely. Take benzodiazepines. They can be prescribed for both anxiety and insomnia, depending on the dose. And then you have your Z drugs, like zopiclone and zolpidem.
Ah, yes, the Z drugs.
They're often preferred for short-term insomnia because they tend to have fewer side effects and a lower risk of dependence compared to the benzodiazepines.
But even though they might be considered safer, we still need to remember they're controlled substances.
Absolutely. Now, let's not forget about those over-the-counter sleep aids. They often contain antihistamines, like D-anhydramine, which also have CNS depressant effects. But here's the takeaway. Never underestimate the potency of these over-the-counter options.
I've heard of people mixing those with alcohol, not realizing how dangerous that can be.
Exactly. Combining them can lead to serious consequences, like respiratory depression. It's a crucial point to emphasize in patient education.
Okay, let's shift our focus to benzodiazepines.
They are like master keys that unlock those GABA receptors, enhancing that calming effect.
And they're controlled substances for a reason. We can't forget about the potential for abuse and dependence.
Absolutely. Those calming and euphoric effects can lead to misuse. And over time, tolerance can develop, meaning you need higher and higher doses to get the same effect, which further increases the risk.
Making those withdrawal symptoms even more intense if someone tries to stop them abruptly.
Now, here's a key point to remember for your exam. Benzodiazepines come in different forms, each with its own duration of action. You've got your short-acting ones like alprazolam,
Xanax.
your intermediate-acting ones like lorazepam,
Aticavan.
and your long-acting ones like diazepam. So it really just depends on what you're trying to achieve. Short-acting benzos are great for when you need quick but short-lived effects, like anxiety before a medical procedure. Long-acting ones might be more suitable for managing ongoing anxiety or sleep disorders, where you need a longer duration of action.
Okay, so what are the risks we should be looking out for?
With benzodiazepines, we're looking at drowsiness, dizziness, confusion, even those paradoxical reactions where they get agitated or aggressive.
Instead of calm.
And of course, there's always that risk of respiratory depression, especially when mixed with other CNS depressants like alcohol.
That's scary. And I'm guessing older adults are particularly vulnerable.
You're right. Age-related changes in metabolism and body composition can make older adults much more sensitive to these medications.
So what happens if someone overdoses on benzodiazepines? Is there anything we can do?
Well, thankfully, there's an antidote. Flumazenil can actually reverse the effects of benzodiazepines, helping to restore normal breathing and potentially saving lives in overdose situations.
That's good to know. Before we move on from benzodiazepines, let's talk about some real-world scenarios
Okay.
where we might see them used, like lorazepam.
Lorazepam is often the go-to choice in the ER for acute agitation or even to manage those really intense symptoms of alcohol withdrawal.
And it can be given in several different ways.
Right, by mouth, under the tongue, through an IV, even injected into a muscle.
And then there's diazepam.
It's commonly used for managing alcohol withdrawal as well,
Okay.
but also for stopping seizures and even calming people down before surgery.
Diazepam really does wear a lot of hats. But I bet there are some important things to keep in mind when using it.
Absolutely. For one thing, you wouldn't want to use diazepam
Right.
in patients with liver problems
Yeah.
because their body might not be able to process it properly.
Makes sense.
Mm.
Are there any other red flags?
Always be mindful of drug interactions. Some medications, like certain antifungals, can increase the effects of benzodiazepines, and even something as simple as grapefruit juice can interfere with their breakdown. Fine.
Wait, grapefruit juice?
Here.
Seriously?
It sounds strange, but grapefruit juice can inhibit an enzyme that helps metabolize some benzodiazepines, causing them to build up in the body.
So, a glass of grapefruit juice with your morning diazepam
Yeah.
could lead to some unexpected and potentially dangerous side effects. Okay, we've covered a lot about benzodiazepines. What about those non-benzodiazepine hypnotics, the Z drugs?
Well, as we mentioned earlier, Z drugs are like the newer kids on the block when it comes to treating insomnia. They offer some advantages over benzodiazepines, including a lower risk of dependence and less of that next-day drowsiness.
Which can be a game changer for people who need to be alert the next day.
Right, and zopiclone is popular for short-term insomnia because it wears off quickly.
Minimizing those hangover effects.
Exactly. And then there's zolpidem, or Ambien, as it's commonly known, which also helps people fall asleep faster and tends to have a lower incidence of daytime sleepiness compared to those benzodiazepine hypnotics.
So, while both Z drugs and benzodiazepines can help with sleep, they have their own nuances.
Yeah.
And choosing the best option really comes down to the individual.
Now, before we jump into more medications, I think it's important to consider the bigger picture. The role of a nurse goes far beyond just administering these medications.
It's about holistic patient care.
Exactly. Nurses are on the front lines, assessing patients, monitoring for side effects, educating them about their medications, and advocating for their needs. It's a multifaceted role.
That requires both knowledge and compassion. And it all starts with a thorough assessment.
Yes.
Digging into their medical history, allergies, vital signs, and overall health picture.
Couldn't agree more. And we also need to understand the patient's specific needs and concerns. Are they struggling with anxiety, insomnia, or both? What other medications are they taking? All these factors come into play when choosing the right medication and dosage.
And once the medication is prescribed, our nursing care doesn't stop there. We're the ones making sure those hypnotics are given at the right time, teaching patients about those potential issues, like REM rebound, and constantly being on the lookout for adverse effects.
Absolutely. And let's not forget about safety, especially when it comes to older adults who are often more sensitive to the effects of CNS medications.
Definitely. Making sure bed rails are up, assisting with ambulation, monitoring for signs of oversedation, all of that is so important.
And speaking of benefits, we also need to make sure those medications are working. Are they sleeping better? Are their anxiety levels manageable?
And that's where patient education comes in.
Exactly.
Empowering our patients to understand their medications and manage them safely.
Precisely. We need to clearly explain why mixing these medications with alcohol or other CNS depressants is a no-no.
Right.
What those potential hangover effects might feel like, especially for older adults, and when they absolutely need to reach out to their healthcare provider.
And they should never stop taking these medications abruptly. Tapering off gradually is usually necessary to prevent those uncomfortable and sometimes even dangerous withdrawal symptoms.
You're absolutely right. Now, we've talked a lot about medications for sleep and anxiety, but let's shift gears a bit and dive into the world of anxiety and depression.
I think it's helpful to break down those different types of anxiety disorders.
Okay.
I mean, we all experience anxiety from time to time, but when does it cross the line into a disorder?
That's a great point. Think about those common scenarios we might encounter. Have you ever been with someone who's terrified of public speaking or attending social events because they're worried about being judged? That's social anxiety disorder, and it can be incredibly debilitating.
Or what about those really intense, like irrational fears of specific things, like spiders or heights?
Those are phobias, and they can trigger intense anxiety and avoidance behaviors. And then you have generalized anxiety disorder, where people experience excessive worry about everyday things.
And then there's panic disorder, with those really sudden, overwhelming waves of fear.
It's a very real and frightening experience. And it's important to remember that anxiety isn't just a feeling, it's a complex interplay of biological, psychological, and environmental factors.
So when does anxiety become a problem that needs treatment?
When it becomes excessive and starts interfering with a person's daily life, their work, their relationships, their overall well-being, that's when professional help and often medication become necessary.
Okay, let's talk about depression. I think there's a misconception that depression is just feeling sad or having a bad day.
Right. Depression is a serious mood disorder that can affect every aspect of a person's life. Their thoughts, feelings, behaviors, relationships, even their physical health.
It's like a heavy cloak that weighs you down.
Yeah.
Makes it difficult to feel joy or motivation.
And the symptoms can vary so much from person to person. Some might experience persistent sadness, while others might feel empty or numb. There can be changes in appetite and sleep, loss of energy, difficulty concentrating, feelings of worthlessness or guilt, and in severe cases, thoughts of death or suicide.
Which is why it's so important to recognize depression as a complex and multifaceted condition. It often requires a comprehensive approach to treatment, involving a combination of therapy and medication.
Exactly. Now let's explore those anxiolytic drugs, the medications that help calm those anxious storms.
They help reduce those feelings of worry and fear, allowing people to manage their symptoms.
And there are different types of anxiolytics, each working in its own unique way. We've already discussed benzodiazepines, which are often used for short-term anxiety relief because they work quickly.
Right.
To boost the effects of GABA in the brain.
So it's essentially slow down.
Yes.
Those overactive neural circuits that contribute to anxiety.
Exactly. But there's another anxiolytic you'll want to know about, buspirone, or Buspar. What makes buspirone unique is that it's non-sedating and doesn't have that same risk of dependence as benzodiazepines.
Sounds like a game changer.
Yeah.
For people who need long-term anxiety management without worrying about getting hooked. But I bet there's a catch.
Well, there's one important thing to remember. Buspirone can interact with certain antidepressants, called SSRIs.
Okay.
Potentially leading to a condition called serotonin syndrome.
Serotonin syndrome.
It can be serious. Essentially, it happens when there's too much serotonin in the brain, and it can cause a whole spectrum of symptoms, from mild agitation and tremors to severe complications like seizures and even coma.
Wow. That's why understanding those drug interactions is so important. Now let's talk about antidepressants.
Okay.
We've touched on a few like SSRIs and SNRIs, but there's a whole family of these medications, each with its own unique way of working.
Let's start with those tricyclic antidepressants, or TCAs. They've been around for a while, and they work by blocking the reuptake of certain neurotransmitters, primarily serotonin and norepinephrine.
So they increase the levels of serotonin and norepinephrine.
Right.
But I remember from pharmacology, TCAs can have a lot of side effects.
You're right. They can cause dry mouth, constipation, blurred vision, urinary retention, even sedation. And here's a fun fact for you. TCA names often end in triptyline, like amitriptyline and norptyline.
Ooh, I like that. It's like a little trick.
Yeah.
To help you remember which drugs belong to this class.
Uh-huh.
But those side effects sound pretty unpleasant. Are they still prescribed a lot?
Not as much as they used to be, especially for depression. They can cause orthostatic hypotension.
Meaning your blood pressure drops when you stand up?
Yes, and that's a real fall risk, especially in older adults.
And sometimes even heart rhythm abnormalities.
You've got it. However, TCAs are still used for certain conditions like neuropathic pain, insomnia, and even bedwetting in children.
Yeah.
And there's one TCA, nortriptyline, that's generally considered safer for older adults.
Okay. Let's move on to another class of antidepressants.
Okay.
MAOIs. They always seemed a bit mysterious to me.
They work by inhibiting the activity of an enzyme called monoamine oxidase,
Which breaks down neurotransmitters in the brain.
Yay.
So they're basically preventing those mood-regulating chemicals from being broken down, leading to higher levels in the brain. But there's a catch with MAOIs, right?
Yes. Patients taking MAOIs absolutely have to avoid foods rich in tyramine.
Tyramine.
It's a compound found in aged cheeses, cured meats, red wine, and a few other foods.
Why is it so dangerous when mixed with MAOIs?
Because it can cause a dangerous spike in blood pressure called a hypertensive crisis, We're talking about a potentially life-threatening situation that could lead to stroke, heart attack, or even death.
Okay, so what kinds of foods should they avoid?
Think about aged cheeses like cheddar, blue cheese, and Swiss. Then you've got those smoked or pickled meats, fish and poultry, yeast extracts, red wines, and even some beans like fava beans.
That's a pretty big lifestyle change.
It is, but for those whose depression hasn't responded to other treatments, MAOIs can be a real lifeline.
Now let's move on to those second-generation antidepressants. The ones that are considered safer and better tolerated than TCAs and MAOIs.
Okay.
SSRIs, SNRIs, and others.
SSRIs, or selective serotonin reuptake inhibitors, work by specifically blocking the reuptake of serotonin in the brain.
So they increase the levels of serotonin. Some common examples are fluoxetine, sertraline, and paroxetine.
Exactly. And SNRIs, or serotonin norepinephrine reuptake inhibitors, block the reuptake of both serotonin and norepinephrine.
And those are used for depression,
Yeah.
but also conditions like generalized anxiety disorder, diabetic neuropathy, and even fibromyalgia.
That's right. Some well-known SNRIs include venlafaxine and duloxetine.
Are there any other second-generation antidepressants we should be familiar with?
There are the tetracyclic antidepressants, like mirtazapine, which has a unique mechanism that actually boosts the release of both serotonin and norepinephrine.
Mirtazapine's interesting.
Yeah.
Because it often causes drowsiness. So it can be helpful for people who are struggling with both anxiety and insomnia.
You've got it. Now, even though those second-generation antidepressants are generally considered safer than TCAs and MAOIs, they're not without their potential side effects.
Okay, what are the common side effects we should be on the lookout for with SSRIs and SNRIs?
We're looking at things like insomnia, weight gain, anxiety, dizziness, headache, gastrointestinal upset, sexual dysfunction.
Oh, right. I almost forgot about sexual dysfunction.
It's a common side effect of SSRIs and SNRIs, and it's something we need to address sensitively with patients because it can really impact their quality of life.
Now, are there any serious side effects?
Absolutely. With SSRIs and SNRIs, there's an increased risk of suicidal thoughts and behaviors, especially in younger patients. That's why there's a black box warning on these medications.
A black box warning.
Exactly. It means that the medication carries a significant risk of serious or even life-threatening adverse effects. So monitoring for any changes in mood, behavior, or suicidal thoughts is absolutely crucial, especially during those early stages of treatment.
Now, what about serotonin syndrome?
Right. It's when there's too much serotonin in the brain. It can be triggered by taking multiple serotonergic medications, increasing the dose of an SSRI or SNRI too quickly, or even mixing these medications with certain herbal supplements.
So being aware of all the medications and supplements a patient is taking is crucial.
Absolutely. Now let's talk about some other things to watch out for. SSRIs and SNRIs can increase the risk of upper GI bleeds.
Okay.
Especially when taken with those NSAIDs like ibuprofen or naproxen.
Makes sense.
And they can also prolong the QT interval.
Which reflects the heart's electrical recharging, right?
Right. And if the QT interval is prolonged, it can increase the risk of dangerous heart rhythms.
So in patients with certain heart conditions, using SSRIs or SNRIs might require extra caution and close monitoring.
You're absolutely right. Now, before we move on, let's talk about a unique antidepressant that doesn't quite fit into the SSRI or SNRI categories. Bupropion, also known as Wellbutrin.
Bupropion has so many different uses.
It does. It's prescribed for depression, of course, but also for things like bipolar depression, ADHD, and even to help people quit smoking.
And they actually market it as Zyban for smoking cessation.
That's right. It's pretty versatile.
But it has its own set of potential side effects, right?
Some common ones include insomnia, increased heart rate and blood pressure, decreased appetite, and a dose-dependent risk of seizures.
So the higher the dose, the greater the risk of seizures.
Exactly. And another important nursing implication with bupropion is to always give it in the morning to minimize those sleep disturbances.
Now let's talk about older adults and these medications. I know they can have unique needs.
You're absolutely right. Older adults tend to be more sensitive to the effects of CNS medications.
Why is that?
Well, their bodies might not process medications as efficiently as they used to, and they often have age-related changes in their brain chemistry that can affect how medications work.
So they might experience stronger or longer-lasting effects.
Exactly. And let's not forget that they're also more likely to have other health conditions and be taking multiple medications, which further increases that risk of interactions and side effects.
That's why starting with lower doses and slowly titrating up if needed is so important in this population.
Absolutely. And we need to be extra vigilant with our monitoring, looking for any signs of oversedation, confusion, falls, or other adverse effects.
And simple safety measures like assisting with ambulation and minimizing clutter can go a long way.
Couldn't agree more. It's about tailoring our care to the individual patient and their unique needs at every stage of life.
Well, I think we've covered a lot of ground today.
We have.
We've explored the intricacies of CNS medications, from those basic mechanisms of action to their uses,
Right.
side effects, and all those crucial nursing considerations.
Absolutely.
We've talked about the importance of assessments and highlighted those key points you'll want to know for your CNUR 202 exam.
We've covered a lot.
But before we move on to part 2,
Okay.
I want to leave our listeners with a thought-provoking question.
All right.
Imagine you're caring for a patient who's just been prescribed an SSRI for depression. What are the key questions you'd ask during your assessment to make sure they are safe and that their treatment is on track?
That's a great question. And it's one we'll be exploring in detail in our next deep dive session.
Stay tuned. Future CNUR 202 champions. The journey continues.
It sure does. So let's talk about those essential questions for a patient starting on an SSRI for depression.
Okay, like where do we even begin?
Well, it all starts with understanding their experience with depression.
Okay.
How long has this been going on? Have they had any previous episodes? What treatments have they tried in the past?
Right, so we're getting a sense of their history to understand the bigger picture. Is this a new thing or a recurring issue?
Exactly. And then we need to look at their current symptoms. What exactly are they experiencing? And how is it impacting their daily life? Are they having trouble sleeping, concentrating, or enjoying things they used to love?
So it's important to remember that depression
Yes.
is not one size fits all.
Absolutely. Some people might be very vocal about their struggles, while others might withdraw and isolate themselves. We need to be sensitive to those subtle cues.
And of course, there's the suicide risk.
Yeah,
It's a tough conversation, but we have to ask.
you're absolutely right. We need to create a safe space for the patient to open up about those difficult topics.
Okay, so what happens if a patient does express suicidal thoughts? What do we do to make sure they are safe?
That's when we need to act quickly.
Okay.
We'd immediately involve a mental health professional, like a psychiatrist or a crisis counselor,
Right.
and they can assess the patient's risk and come up with a safety plan.
So in those moments, safety is our top priority.
Now, aside from those immediate concerns, we also need a comprehensive medication history. What are they taking? Both prescription and over-the-counter.
Okay.
What about herbal supplements or recreational drugs?
This is where we have to think about potential drug interactions.
You got it. Many substances can interact with SSRIs,
Oh.
either increasing those side effects
Right.
or making the medication less effective.
So we're preventing those problems before they even start.
Exactly. We also need to know about any medical conditions they have, especially liver or kidney problems.
And allergies.
Right. We need to know if they have any allergies to medications, especially SSRIs. Okay, so we've talked about their depression, symptoms, medical history, and medications. What's next?
I'm guessing it's time for a physical exam.
Exactly. We'll check their vital signs, focusing on their blood pressure and heart rate.
Why those two?
Because SSRIs can sometimes cause changes in blood pressure and heart rate, especially when they first start taking the medication.
Okay, so we're getting those baseline readings. What else are we looking for during the physical exam?
We're looking at their overall physical health for any signs of problems that might be related to their depression
Okay.
or that could get worse because of the medication.
Can you give me some examples?
Think about changes in weight, appetite, sleep patterns, energy levels. We'll also assess their mental status. Are they anxious, agitated, confused, or are they having any unusual thoughts or behaviors?
So we're creating a whole picture of their well-being.
Precisely. And once we've completed that thorough assessment, we can move on to those nursing diagnoses and create a care plan just for them.
And those nursing diagnoses, they're like our roadmap for care, right?
Yeah.
What are some common ones we might see in a patient starting an SSRI?
Well, risk for suicide is always a top concern, especially in those first few weeks of treatment.
We've talked about that. And it's a reminder to be on the lookout for any shifts in mood or behavior.
Absolutely. We might also consider things like ineffective coping, disturbed sleep pattern, or even social isolation.
So our nursing diagnoses come directly from the assessment, helping us focus on those specific areas where they need our help.
You got it. And those interventions should always be individualized.
Okay, so what are some specific things we can do to help a patient who is starting on an SSRI?
We start by building a strong therapeutic relationship, provide emotional support, active listening, and create that safe space for them to express their feelings.
That relationship is so important.
Absolutely. We also need to educate them about their medication,
Okay.
explaining how it works, potential side effects, and how to take it so they can feel empowered.
And what about side effects? How do we help them deal with those, especially the ones that are really annoying?
Well, many side effects like nausea or headaches tend to get better as they adjust to the medication. We can suggest taking it with food or over-the-counter pain relievers.
What if they're having problems with insomnia?
We can talk about good sleep hygiene, like a regular sleep schedule, avoiding caffeine and alcohol before bed, a relaxing bedtime routine, and making sure their bedroom is cool, dark, and quiet.
Okay, but what if those things don't work?
We might consider behavioral therapies for insomnia or maybe a short course of a sleep medication, but that's something to decide with their healthcare provider.
And we have to remember those potential interactions with the SSRI, the special benzodiazepines.
Exactly. So it's about finding the right approach for each person.
And constantly checking to see if they are responding to the medication and if the side effects are manageable.
Precisely. It's an ongoing process.
And we need to remember that supporting their overall well-being is just as important as managing their symptoms.
It's all interconnected, and our role as nurses is to address those different facets of their experience.
And patient education is a huge part of that, to help our patients take control of their care.
Absolutely. When it comes to CNS medications, there's a lot to cover. We need to make sure our patients understand those potential risks and benefits, how to take their medication safely and effectively, and what warning signs to look out for.
That can feel like a lot, especially if you're already struggling. So where do we start with all that?
We start by explaining what the medication is and how it's supposed to help them, using clear, simple language. And we'll make sure they understand why they're taking it and what they can expect.
Because those expectations are important.
Yes.
Antidepressants don't work right away. It takes time.
You're right. We want to encourage them to be patient and stick with it.
So we've explained how the medication works. Now, what about side effects? How do we talk about that?
Honesty and transparency are key. We need to talk about possible side effects, but also emphasize that not everyone experiences them, and they are often mild and temporary.
So we want to inform them,
Yeah.
but also empower them.
Exactly. We can also offer some tips for managing those common side effects, like taking the medication with food.
And if they experience anything unusual,
Yes.
they should contact their doctor.
Absolutely. We also need to stress how important it is to take the medication exactly as prescribed, even if they start feeling better.
Why is that so important?
Because stopping suddenly can cause withdrawal symptoms.
Yeah.
And they might even relapse.
So they need to be consistent.
Yes. What else? Oh, those interactions. We need to talk about other medications, supplements, and even certain foods that can be a problem.
Like those tyramine-rich foods.
Yes. So always look at their complete medication list.
And they should probably avoid alcohol while taking these medications.
Definitely. Okay, so we've covered the basics of the medication, potential side effects, taking it as prescribed, and those potential interactions. What else is important?
What else do we want them to know?
We want to encourage them to take an active role in their care. This means tracking their symptoms, noticing any changes or improvements, and telling their healthcare provider.
So it's a team effort.
Exactly. We're all in this together, working towards their well-being.
Well, we've really gone in depth into caring for patients, taking CNS medications, from assessments and diagnoses to interventions and patient education.
It's a lot to take in.
Before we move on to part 3, though, I have another question.
Right.
Imagine you're working on a busy psych unit.
Yeah?
And you have several patients,
Yeah.
all taking CNS medications.
Mm-hmm.
How do you stay organized, keep everyone safe, and still provide that personalized care?
That's an excellent question, and it's one that we'll be tackling head-on in part 3.
So stay tuned for more practical tips and strategies to help you navigate the complexities of CNS medications. Okay, so how do we stay organized and keep our patients safe when we're juggling all these different CNS medications?
It's a real balancing act, especially on a busy psych unit.
It can feel overwhelming. So many patients, so many meds, so many potential problems.
But remember, we don't have to do it all alone.
Right, we've got our team and all those resources to help us.
Exactly, like those drug monographs.
Oh yeah, drug monographs.
They're like our cheat sheet.
They list all the essential info about each medication. I used to feel so overwhelmed in nursing school with all the meds we had to learn, But those monographs really helped.
It's all right there. Indications, contraindications, dosages, side effects, interactions, they've got it all.
It's so much easier to access information these days, too, with online resources and apps.
But even with all that, we can't forget about our critical thinking skills.
Oh, critical thinking. That's the cornerstone of nursing.
When it comes to CNS meds, we have to be able to see the whole picture.
Right.
Spot those red flags, anticipate potential issues.
And tailor our care to each individual patient.
Exactly. It's like putting together a puzzle. We're thinking about their needs, their history, their meds, their lifestyle. It's all connected.
And then we use that information to make decisions about their care.
Like adjusting dosages or monitoring for side effects.
And being ready to step in if something isn't right.
Right. It's a continuous process. We have to constantly assess, plan, implement, and evaluate.
It's the nursing process in action. And it's why we have to keep learning. The world of healthcare is always changing, and we have to keep up.
That's why deep dives like this are so important.
I agree. They help us refresh our knowledge and learn those new concepts.
And hopefully this deep dive has given you what you need to rock that CNUR 202 exam.
I know I'm feeling more prepared. We've covered so much.
We have. We've discussed those different medication classes, the complexities of anxiety and depression.
The importance of patient-centered care.
And never forgetting those critical thinking skills.
So to all our future CNUR 202 nurses out there, remember, you've got this. You have the knowledge and the passion to make a real difference.
So keep learning, keep growing.
And never stop exploring the fascinating world
of CNS medications.
That's all for this deep dive episode. See you next time.